Hi, my name is Dr M Niharika. I am working as a fertility consultant in Kamineni Fertility Centre. Today I would like to speak about male factor infertility. So as we know, infertility is inability to conceive even after trying for ample amount of time in a couple. So infertility ranges for about 15% of the whole reproductive couples. Infertility is again can be because of different causes. It can be either a female factor, it can be a male factor, it can be a combined factor. So on par with the female factor of causes of infertility, male factor also accounts for about 40 to 50% of the causes of infertility. A basic test we do in a male is to analyze the sperm count. As we know, for a normal fertilization to happen, we need one egg and one sperm. So whether the male person or the male partner of the couple is having good quality and the quantity of the sperms or not is what we assess, and this is done by a basic semen analysis. So on a basic semen analysis, if the semen parameters, broadly speaking about the count, motility and morphology, if these parameters are normal, then the couple have not suffering from any male factor infertility. But either of the semen parameters, if they are deranged, then that can cause subfertility or infertility. So there are different kinds of abnormal semen parameters which can lead to male factor infertility. There can be decreased count. Decreased count can be of again three types, which we term it as oligozoospermia. Oligozoospermia can be either mild, moderate or severe. So normal cutoff that we take for a semen parameter or the count is 15 million per ml. If a person is having less than 15 million per ml sperm count, then he will be coined as an oligozoospermia patient. So obviously if the count is low, then the chances of conception are coming down. That is the reason semen parameters, the count, motility and morphology have to be in the normal range for us to help counsel the patient that they can try naturally. But if a patient is having abnormal semen parameters like decreased count, decreased motility or decreased morphology, the shape of the sperms are also, if they are abnormal, can also be a cause why the patient is not able to conceive. So in all those circumstances, we as fertility specialists can help the couple achieve pregnancies of their own. For the fact, sometimes the severity of the male factor can be in terms of complete absence of sperms as well. So if the complete absence of sperms is seen on at least two semen analysis tests, we term the patient to be of azoospermia. So in azoospermia patient, we also can achieve pregnancies of their own by helping them in the form of in vitro fertilization and the ICSI, that is intracytoplasmic sperm injection. So even the couple, if they are having different kinds of male factor infertility or the abnormal semen parameters, there is always a help from our side that we can do to achieve pregnancies in the couple. So if a patient is only suffering from mild parameters, that is oligozoospermia or asthenozoospermia, then medication, simple medication, change in lifestyle and change in the diet pattern and the nutrition that they are taking can help the patient improve the counts. But if the male factor is severe, that is the count is very low, less than 2 million, 3 million or only 1 million, then that defines again the severity of the male factor, and in such cases it is not possible for the couple to try naturally or through other less assisted reproductive technique, that is IUI. So in these patients, intracytoplasmic sperm injection is of very good help to achieve embryos and henceforth successful pregnancies. Have difficulty with the motility. So there are varying combinations of the abnormal sperm parameters, that is sometimes the count is normal but the motility is low. Even in such parameters, there is a difficulty in conceiving naturally, and hence the IVF or the ICSI procedure will be more helpful. So coming to the azoospermia, so whenever a patient is found to be having azoospermia, nil sperm count on the semen analysis, we first basically evaluate with the hormonal investigations and a basic ultrasound to assess the production of the sperms. So first we have to categorize the azoospermia into either obstructive or non-obstructive. Obstructive azoospermia meaning there is still the sperm production present in the testicles, but the passage through which they come out may be blocked at some location, and that could be the reason why the sperms are not coming outside. The other type of azoospermia is non-obstructive azoospermia. This mostly can be because of the genetical situation or a trauma at the young age, in a boy, where the testicles have been damaged or the germinal epithelium in the testicles has been damaged, and that is the reason there is no sperms being produced even in the testes. The evaluations of the hormone and the ultrasound will help us understand whether the azoospermia is either the obstructive type or the non-obstructive type. But even in the obstructive type of azoospermia, even if the sperms are not coming out, we can still help the couple achieve pregnancy of their own by doing the simple procedure of ICSI with the testicular sperms aspirated through the TISA procedure. The TC procedure is nothing but testicular extraction of the sperms. This can be done either percutaneous way or an open biopsy. And even in more advanced situations where there are very few sperms left in the testis, can also be retrieved with the advanced procedure called as micro-TC. Micro-TC is nothing but the testicular epithelium, which is the seminiferous tubules in which the sperms are contained, can be examined under a higher magnification and in a more detailed way, and they can be aspirated and used for preparing the embryos. So in this way, even the obstructive and non-obstructive azoospermia patients are helped at our center with the help of the TC and micro-TC, so that we can help them achieve pregnancies of their own.